All right, so welcome everybody, and thank you for joining us for today's presentation, Exploring Medical Cannabis. My name is Michelle, and I'm the program coordinator here at Waterford Place Cancer Resource Center. Again, Waterford Place provides programs and services free of charge to anyone impacted by a cancer diagnosis that supports whole person care. I'm pleased to introduce our speaker this evening, Beth. She is an outreach specialist with Rise Dispensary. So Beth, thank you so much for your time, and I will turn it over to you now.
Super. Hello, everybody. I'm Beth Whitley. I'm the outreach specialist for Rise in Naperville and then Rise in Joliet. I'm super honored to be here with you guys tonight. Again, today we're going to be talking over quite a few topics, but they will all be centralized about cancer and cannabis. My information is here. Should you have questions, feel free to call me, shoot me a text, or you're always welcome to email me as well. We will get started. All right. So, first we'll go over our agenda and hop in. We'll start with a little bit of an introduction to cannabis, go over some vocabulary that's important to understand should you want to come visit us as a medical patient or an adult use guest. So we will start with basic cannabis knowledge. We'll talk a little bit about cancer and cannabis, and I will give you guys some resources, really popular resources, the ones that you would hear us talking about if you come into a Rise dispensary. We'll talk about different routes of medicating and products that are available to you. We'll talk about the difference in those effects of different routes of medicating. We will switch over to the Illinois Medical Cannabis Program in 2019 and 2020, actually, and then we'll talk about what happened last year, some of the updates with that, and then give you some more resources, and we'll finish out with a Q&A session. So first off, I want to let you guys know where most of my information, well, all of my information will be coming from tonight. These are going to be two of the biggest resources for the screenshots that I will share, and then some of the studies that we will talk about with cannabis and some of the research that we will discuss today in reference to cancer. Some of those things are going to be anecdotal things when we talk about how products work for mitigating symptoms associated maybe with treatment. And then we'll also reference the Americans for Safe Access and their research when we talk about some ways that the chemicals in cannabis interact with cancer itself within the body. So first off, I want to start with, this is a screenshot of our website. The thing that I want to draw your attention to here is if you go to risecannabis.com, up in this top area, I don't know if you could see my cursor or not, but in the top right corner or the top right middle, you'll see cannabis resources. That's also going to explain a lot of the information that we're going over today. So in addition to maybe getting this recording, you can always hop on there and find even more articles and research that's coming out about cannabis. All right, so let's get started. Oh, and I'm flipping through here. Sorry about that. So let's get started with cannabis and some vocabulary. So when we talk about cannabis, there are two main categories that we think of what the effects are going to be with a certain product. On one end of this spectrum, we have what's called indica, and on the other side of the spectrum, we have sativa. So with indicas, we have a little nomenclature that goes along with it, albeit a little elementary. It does help you remember what these do. So with indica, we say indicouch. If you use a lot of indica, you tend to want to stay in your couch. With sativas, they're going to be on the opposite end of that spectrum. They're going to be more of our daytime uplifting, euphoric, creative strains. Now, these two categories will exist across all of the routes of medicating or all the different products that we're going to talk about. And we'll break that down as we move through this presentation. The big takeaway here is if you go into any dispensary, whether it's medical or adult use, you will notice that the products are going to be separated into indica, sativa, and then at the bottom of this slide, it mentions hybrids. So With our indicas, those tend to be more relaxing and nighttime focused. Often we think of indicas with mitigating pain and helping to sleep. And then, as I said, sativas are going to be more of our uplifting daytime strains. So perhaps you're looking for an experience that's uplifting in mood, but you also need your body to relax because maybe you just had a long, rough day. You would look for something that's going to be in the middle of those products, and that would fall into the hybrid category. So again, looking through any menu, you're going to notice these three words. They're going to be super important as we continue through this presentation. Now, we're going to shift over here into what we consider the active ingredients in cannabis. So this image on the right, Cannabis Man, breaks down what each one of these cannabinoids in the cannabis plant offers us when we consume cannabis. Cannabinoids are going to be the chemical compounds that are in the plant that replicate a system that our body already has set up. So one thing that is kind of new in research with cannabis is our endocannabinoid system. Within every human and every mammal, we have this system. Our body naturally regulates this system by creating hormones. Sometimes we are exposed to trauma or crisis, or perhaps going through cancer treatment, where we have to offset this system, whether that is through the medications that we have to take or just extended periods of stress. This system can become unbalanced. So what we're doing with cannabis and with these active ingredients is we are essentially supplementing the system that our body would naturally regulate, but for, in this case, cancer is offsetting that, or our treatment that we're going through is offsetting that balance. So we're going to break down the top three chemical compounds in cannabis, or the top three cannabinoids that we work with in the dispensary. Now, if you take a really close look at Cannabis Man right here, you'll notice that there's a lot more than 3 colors that are being represented here. If you come into the dispensary or you want to continue your research, you can look into a lot more of these cannabinoids, and you're also welcome to join any other educational classes that we have. We do break these down, but I really want to stick to the top 3 and kind of apply them to what how they could mitigate some of the most common things that we see with individuals who have been diagnosed with cancer or are going through cancer treatment. Oh, and I'm having trouble with my slide. There we go. Okay, so the human endocannabinoid system, as I referenced, exists in all of us. This little guy on the right side of this screen is just going to be a visual representation of how the receptors in our body are broken down. This can get a little bit medical and a little bit technical, but there are some really important points here just to understand how these chemicals are working in your body, and so you can better set yourself up for what you're going to experience if you are new to cannabis or if you're trying a new product for the first time. So the first thing that we want to talk about on this slide is going to be the light blue colors when we're looking at the image of the person. This light blue is representing where our body takes in THC. Now, in the next few slides, we'll break down in detail what each one of these cannabinoids or these chemicals do. But for this purpose, we want to focus on where these colors are located in the body. So with THC, it's pretty widely known, and we'll talk more about it, that THC is the psychoactive part of the cannabis plant. This is the chemical that when we ingest it, causes us to feel high or causes euphoria or cerebral stimulation. So if you take a look at the little graphic of the man, you'll notice that the light blue is really concentrated along the spinal cord and in the brain. So this is just a visual representation for us to understand that if we intake THC, we're going to be affected in our central nervous system or in our brain. So we expect to feel high, and then in the spinal cord. So we expect that THC is going to help us to stifle pain or pain signals. So we would feel less of it. The next big point here that we want to talk about is the dark blue colors and how they're dispersed in the body in this image. So the dark blue is referring to where our body uses CBN, which is that bottom key, and CBD. CBD tends to be more popular. A lot more people know about CBD, but CBN, again, we'll break it down, but CBN is going to be more responsible for handling inflammation and overall relaxation. So when we're talking about maybe muscle pain or bone pain, CBN can be really helpful for that. And when we take a look at how the dark blue is dispersed in our picture, in our graphic, we can see that it congregates or it centralizes in some of our organs. And then if you notice, this little man is outlined in this dark blue color. So we have a lot of receptors on our skin. So individuals who may be may have incision pain or neuropathy or feelings that are a little bit closer to the surface of the skin, activating this receptor can be more beneficial. Now we're going to break down each one of these three, and we will circle back to this graphic just to clear up if there's any confusion. Feel free to stop me if it gets a little wild, or if you have any questions, I'm happy to explain. So we're going to start first with THC, tetrahydrocannabinol. Again, a lot of people know bits and pieces about this chemical because it is the reason that dispensaries exist. You can't just buy cannabis over the counter because it is a controlled substance. And the reason it's a controlled substance is because of this chemical. THC, as we saw in the graphic before, is what is responsible for mitigating pain. So if your main goal in using cannabis is to regulate pain or to help to stifle that feeling, then we would suggest a certain amount of THC. One thing that I really like to talk about when we're talking about THC and its ability to help with pain relief is that THC does not exist in raw cannabis. So if you come into the dispensary and you purchase flower or bud or the dry herb that is cannabis, it's kind of depicted here on the right side of this slide. THC does not exist in the plant itself. If you were to just buy some flower from us, or if you were to harvest a plant and then test it, it would have THCA in it. That's the raw form of THC. This is really significant to us because THC does not have any psychoactive effects. What that means is you can use cannabis in its raw form and not get high while maintaining the amount of pain that you're feeling. So you can kind of regulate the pain sensation in your body by using raw cannabis and not getting high. It's not until we light cannabis to smoke it or we bake it to make an edible that it becomes THC. And that's the form of cannabis that is responsible for being high. THCA, a couple of quick applications with THCA that we see would be buying dry herb or raw flower and sprinkling it on a dish that you're about to eat, or blending it in a smoothie that you're drinking. Some people will just break it down and put it into capsules and then take a capsule whenever they need to. Cultivators and businesses that create the products in the Illinois cannabis industry have started to become keen to THCA and its draw for its non-psychoactive properties, And we do have a few products in the dispensaries where you can just use THCA that are already dosed out for you. One of those is in a patch form, which we'll talk about again later. The other one is going to be in a tincture form, or a product that goes under the tongue. And we'll talk about some of the pros and cons that go along with that as we move through. So THC and cancer. As we go through some of these studies, and I just pulled up screenshots, I'm happy to also share this article. Typically, when we did this in person, we would have the article handout and all of that stuff. So I do have all of this digitally if anybody is interested here. But some of these studies that we're talking about, I will say the majority of them, the scientific studies are going to be on animal subjects. Again, when we talk about products in a few slides, we'll talk more along the lines of anecdotal studies and things that we notice with our guests who come into the dispensary. But here we see, and this is again according to Americans for Safe Access and their studies. So we see here that at low levels, THC reduced the migration and invasion of cancer cells, while at high concentrations, THC triggered cell death in tumors. Again, this is going to be a study that was done in a lab on animal subjects. But I do just want to point out some of this stuff because if you look this up on the internet, if you walk into a dispensary, one of the most common regimens that is suggested to an individual with cancer is going to be a high THC regimen. So I just want to kind of connect some of those dots and maybe support some of what you would hear if you do decide to come to a medical dispensary and sit down and talk about some of our products. Now, the second part of this research on the right side of our screen is going to talk about cannabis usage in relation to chemotherapy. So maybe some side effects that may be happening. If you are not familiar, there have been quite a few pharmaceuticals that have been created and are regularly used in hospitals that mimic THC, or as you can see at the top of this screen, the underlined in red says Delta 9 THC. So that is the THC that we just spoke about in the screen before. And in this little example, it speaks to Marinol. Not sure if anybody on this call has heard of Marinol. Another really popular drug is called Sativex. Both of those are synthetic derivatives or creations of THC. So what this part of the research is talking about here is that THC has been found to be fairly successful in mitigating nausea, vomiting, those sorts of feelings in association with chemotherapy and treatment for cancer. In the second part of the right side of our screen, under the title of Research on Cannabis and Chemotherapy, again, this is just going to speak to a different study that supports THC being helpful in the mitigation of pain, nausea, vomiting, and then one of the more popular ways that we see cannabis being used in relation to chemotherapy is to stimulate appetite. So definitely one of the side effects of THC is appetite stimulation. That could be very helpful if you are experiencing cachexia or any sort of wasting, or just having trouble finding food to be appetizing anymore. We do have quite a few products that are very helpful for stimulating appetite as well as mitigating pain. Next, we'll move on to the second most, perhaps first most popular or well-known cannabinoid, CBD or cannabidiol. CBD kind of moved into the main stage in 2019 when hemp became legal to cultivate grow, extract, and infuse. This is a good time to talk about a little bit of the differences between what you're purchasing or what you're able to purchase over the counter and what you would purchase in a medical or an adult use dispensary. So with cannabis, there are many different kinds of cannabis that live within the cannabis family. One of those is the hemp plant, and then the other one would be the cannabis plant that we sell in the dispensary. Anything that is derived from the hemp plant is legal to sell and cultivate over the counter. So if you were to go into Walgreens or CVS or perhaps Jewel-Osco and pick up a bottle of CBD, you would be purchasing a byproduct of the hemp plant, which would be different from what we sell in the dispensary. So products that we sell in the dispensary are always going to have at least a small amount of THC in them, because by nature, that's how that plant grows and produces its chemicals. We do sell products that we consider to be CBD only products because the amount of THC in there is so minute, and the interaction between THC and CBD stifles the effects of THC. So CBD is very popular and is very well known for its anti-inflammatory properties and is very well known for being a relaxing chemical. As we saw in the graphic that we started with, CBD receptors are spread out throughout our whole body. So when we use CBD, we do expect more of a body effect and a full body effect, as opposed to THC, where if we remember from the image, it's centralized more in the head. So we would expect it to feel a little bit more euphoric. A little information here. Federal law does allow for over-the-counter products to have up to 0.3% THC. So just a little consumer education. If you do go and purchase a product over the counter and it says the words full spectrum, that is just a nod to you to perhaps take a look and see if there is THC present. The only reason that's significant is if you do need to pass some sort of drug test, or you think that you would not have THC in your system for any reason, hemp producers are allowed to have a certain amount of THC in there. So that's just a little bit of education and information. So if you do pick up a product, you understand what's going into your body and perhaps what would show up on the test. And then, yes, as I said, if you do purchase product in any sort of dispensary, we will always tell you that there is THC present, even if it's as small as that 0.3% that is federally illegal to be sold over the counter. Alrighty, so CBD. First, we'll talk about this study on the left, which actually talks about relief with cannabis in relation to similar relief felt with opioids. So in 2009, a clinical trial involving 177 patients with irretractable cancer pain experienced and who had experienced inadequate relief from opiates showed remarkable reduction in pain scores from using cannabis extract, which contained THC and CBD. And this talks a little bit about the ratio of using both CBD and THC in our bodies. This also speaks to the fact that using both THC and CBD showed an improvement in mood and could be helpful in relieving symptoms of anxiety and depression. Just like we saw in that first image where we have both the light blue and the dark blue receptors, it kind of makes sense for a system that revolves around balance to be activating both types of receptors. We often see across the board, regardless if we're talking about cancer or Alzheimer's or ALS or any of the qualifying conditions, utilizing some sort of ratio of THC and CBD has significantly more effects and oftentimes our guests can get the relief or the effects that they're looking for with significantly less medicine if they utilize both chemical compounds at the same time. We'll talk a little bit about those ratios and some things that may be more helpful specifically for this group. In this article, they are talking about a 1-to-1 ratio, or the same amount of THC as CBD. If you go onto the Rise menu, for example, and you start to look through some of our edibles, some of our sublingual products like tinctures, things that go under the tongue, you'll notice that there's a lot of different ratios. And we'll talk about that in just a couple of slides. But this article is referring to a 1-to-1 ratio, or equal parts THC and CBD. Alrighty, so back to this image. CBN is the last chemical that we haven't talked about that's showing up here. That's going to be on our next slide. The first thing that I want to talk about is when we're using THC and we introduce CBD into the mix, CBD actually mitigates the psychoactive effects of THC. So let me say that another way. If we need to use THC to regulate pain, but you, much like most of our guests, want to remain functional throughout your day, regardless of what you're using, we would suggest using a product that has more CBD than THC in it. So we can increase your THC amount to mitigate your pain, but we're going to also increase your THC in the same proportion so that you are remaining functional. As a rule of thumb, a 10-to-1 ratio, or 10 parts CBD to 1 part THC, is what we would consider a non-psychoactive ratio. So in the Illinois market, we have products that range from that 1-to-1 or equal parts all the way up to 20-to-1 or 30-to-1. So if we're looking for a product that's going to give us that pain relief and relaxation, and we're going to stay functional, we're going to look for something that has a higher amount of CBD to the relationship of the THC. Now, we're going to scooch down to this third cannabinoid so we can be done with the basis of what we're working on tonight. So CBN. CBN is actually a derivative of THC. If you were to leave a cannabis plant or the raw flower out exposed to light, heat, and oxygen for about 6 months and tested it, you would no longer have THC. You would no longer have that psychoactive chemical that we have talked about. It would actually convert to something called CBN. CBN's claim to fame and how it became really popular is that it is an appetite stimulant, and it actually helps you to go to sleep and stay asleep, very similar to how melatonin or cherries work with our circadian rhythm. So again, cultivators or the companies who create our product have started to become aware of the popularity of this chemical, and we actually have quite a few products that highlight CBN. Most of our products in the dispensary are not going to be just one chemical because the plant creates so many of them. It's going to be more of an experience of picking a product that has more of the chemical that you are looking for. So an example of this would be perhaps you're looking for something to help you sleep or wind down at the end of the night and relax so that you can start your nighttime routine and get into a place of restful sleep. We have products that are going to be equal parts CBN and THC, or we have products that are CBN and CBD. We do have a few products that put all of them together, like topicals. That could be really helpful if you are experiencing joint pain, Perhaps it is in some of your bigger joints or multiple joints. Using a topical that has both THC, our pain reliever, CBD, our anti-inflammatory, and then CBN, which is going to help to calm the whole central nervous system and relax, can just have a more effective effects for you, and using much less of a product than if you were to just choose one of these chemicals. All right, so we are going to just do a little time check here. Okay, so we're going to hop into routes of medicating, and then we will go through the medical program in Illinois and wrap up. So routes of medicating. None of these lists are all encompassing by any means because the industry is growing so quickly and companies are coming up with the most innovative ways to get you your medicine in an everyday package. So edibles, will start there, routes of medicating edibles, a very popular route of medicating. But this could include anything from chocolates to gummies to taffy, honey, tea. We even have things like French onion soup mix. We have Arnold Palmer mix. We have sugars and baking ingredients. So the sky's kind of the limit on edibles right now, and we'll break down each one of these, some pros and cons associated with each one, but we'll do a quick introduction here. So topicals are going to be anything like a lotion, salves, oils, bath bombs, even things that you can soak your body in. We have transdermals, which will be products like patches, compounds, and suppositories. Sublinguals are going to include things like tincture and then inhalation, perhaps the most popular when we think of cannabis, maybe edibles these days, but regardless, inhalation being flour, wax, shatter, butter, oil, and hash. So edibles. Edibles in the state of Illinois are, everything is very heavily regulated, but our edibles have a lot of restrictions on them, which make it pretty easy for the consumer to figure out what they have in their hands. So in the state of Illinois, all of our edibles cannot exceed 100 milligrams of THC. So if you take a look at our menu, you'll see, like, for example, this chocolate bar, Windy City chocolate bar. In the corner, on the right corner, it tells you it has 10 pieces in it. We know in the state of Illinois that our products are 100 milligrams, and it says that on the front. But if we know that there are 10 pieces in there, each square is going to be 10 milligrams per square. Also, on the product, when you break off the square or you open up your packaging, it will say on it 10 milligrams. If you take a look in the bottom left corner where we see the Bebo little tarts, you can, I'm not sure if your device is big enough, but you would notice that there is a stamp of a bee on that tart. And then on the other side, there would be a 5 milligram and then say THC on there. So most of the products in Illinois are going to tell you what the dosing is, and for sure your packaging has to tell you by law how much is in the total package and then how much each piece is. With edibles, the onset time, or the time it takes to feel effects, can take up to 2 hours. That's really important to remember if you're trying a product for the first time or you're new to edibles, because you want to make sure you take your edible at a time that makes sense for the onset time, and you wouldn't want to keep adding to your edible until you're experiencing the full effects of it. While edibles may take 2 hours to start working, they are one of the longer lasting routes of medicating. They do last about 4 to 6 hours in the body. So this is a great product if you're needing a longer term, a longer time period of effects. But again, it can take a little bit to kick in. Next, we have topicals. Here we just have a picture of a muscle freeze. This is one of our CBD products. This is a topical, meaning you would use it in the area where you have pain. So perhaps your hands are hurting, your feet are hurting, a topical is a really great choice for a smaller area and where you want the relief to be in that area. With topicals, we expect the onset time to be around 10 minutes. Most people start to feel effects pretty immediately, but it can take 10 to 15 minutes for full effects. And then we would expect that to last for about 2 hours. So again, a topical is something you would have to keep putting on throughout the day, but supporting a topical internally with an edible can help you to kind of combat your pain or get effects from both the inside and the outside. Now, perhaps you are experiencing all over pain like neuropathy or arthritis throughout multiple joints. It may not be ideal for you to take a pump and put it all over your body. That might be a little bit excessive. So that's where transdermals come in and how they're a little bit different. So a topical, again, is something you would put on the area where it hurts. A transdermal is more effective for an entire body relief. So some of the more popular products that we have in the dispensary are going to be these patches. As you can see, the patch on the left is THCA. So again, the non-psychoactive version of THC, a really popular cannabinoid to help mitigate pain while staying functional. These patches are formulated to slow release, so they do have an extended relief feature, if you will. They are meant to last for about 10 hours, so significantly longer than a topical. But again, you would expect to feel effects throughout the body with a transdermal. On the right here, we see a compound. This, if you were to open it, is much like a salve. You would put it on a venous area. So transdermals, you're going to put on a venous area like the wrist, the top of the foot. I always suggest a venous area nearest your biggest amount of pain, or if you have a pain source, to put the product closest to that. Some individuals will put these patches on the inside of the hips. If you have hip pain, lower back pain, those sorts of things, patches can be really nice. And then lastly, but certainly not least, in transdermals are suppositories. Suppositories tend to have one of the highest absorption rates for a transdermal. They tend to work very quickly, and they tend to last for about 4 to 6 hours in their effects. Next, we have sublingual routes of medicating. These are going to be things that go under the tongue. These have the second fastest onset time, which is going to be 15 to 20 minutes, and these can last 4 to 6 hours. They can be a very discreet way to be medicating throughout the day, and they do have a pretty significant amount of time that they will last for you. This product here that is shown is CBD, and if you notice underneath where it says CBD, it does say 500 milligrams. So as I spoke about earlier, in the state of Illinois, there is a law that we are maxed out at 100 milligrams for THC, but there is no maximum for CBD products. So you would absolutely see a product like this in Illinois. We do even have some cultivators that do, like I said, the 20 to 1 in a tincture form. So that's actually 2,000 milligrams of CBD and 100 milligrams of THC. So as long as the cultivators are staying at 100 milligrams THC or lower, it is an acceptable product. And then lastly, we have inhalation. So these are going to be the products that we inhale into the lungs. These have an onset time of nearly immediately. It's going to be 2 to 5 minutes until you have maximum effects, but you'll feel the effects pretty quickly. And it's also the fastest to leave our body. So inhalation effects typically last 1 to 2 hours. So we would expect, if you were using only inhalation, that you would need to continue to medicate frequently throughout the day. When we are talking about edibles, I don't think that we can educate too much about them because they happen to be delicious in a lot of cases and sometimes a little bit tempting to continue to eat. So it's important to understand why we wait and why the effects are quite different. So if you are new to cannabis and you are contemplating routes of medicating, or maybe you smoked before, perhaps when you were younger, and now you don't want to smoke, which you don't want any inhalation, that's very popular, and you're going to try an edible, we do just want to let you know that it's going to feel different. So when we inhale cannabis, we are experiencing THC, like we've talked about. When we eat cannabis, it actually takes that 2 hours for us to start feeling it, because we have to wait for it to digest. We have to wait for it to get to our liver. And at that point, it converts to something called 11-methyl hydroxy. Not important, other than that we understand that it's about 5 times as potent as what we inhale. So the feeling is quite different. The onset time is very different. And it's important that we expect that when we're trying a new edible. This next image is just going to break it down for us in some pretty colors. Again, with smoking, we are experiencing that THC that we talked about in a large amount. When we eat cannabis, we have a lot of that hydroxy THC, which is quite a bit more potent. So we have a motto at our Rise dispensaries. We say low and slow. Often when we introduce somebody to a new edible, that's kind of our farewell salutation, is low and slow. We would definitely prefer that you feel nothing than have a negative experience. So if you ever have questions about dosing a new product or anything, we're always happy to help with that as well. And then a really popular way that our guests and our patients use our product is using more than one at the same time. Here, this just shows an example of perhaps doing an inhalant and an edible at the same time. That would allow you to have that fast onset of an edible. The fast onset of an inhalant, or we could say a sublingual, right? Something that goes under our tongue. We'd have that fast onset. And then as that is waning off, our edible would be picking up in potency. So just a graphic to kind of introduce you to the idea of how can I medicate one time and get through the majority of my day without continuing to have to use product. So in the state of Illinois, we're going to talk just about one of the programs, the most popular one that we see for those who may have a cancer diagnosis. I have circled here some things that may qualify the individuals who are tuning in tonight. By no means do you have to have these. And for the state of Illinois, you only have to have one qualifying condition in order to get a medical card. For the medical cannabis program, we are focusing on this top line here. So the medical cannabis patient program is started by you going to a medical professional, perhaps one you already have a relationship with. They would complete the form that is that the state has them fill out. It is called the healthcare certification form. At that time, they're certifying that you have one of those qualifying conditions. In the state of Illinois, they do not require that your doctor prescribes or recommends any product. They rely on the patient care specialists and educators in the dispensary to help you along with that process. So your physician or your healthcare professional is simply certifying that you qualify for the program. We do offer free assistance at the dispensary. Most dispensaries do, with submitting your application to the state. If we continue across this chart, you'll notice that you can sign up for 1, 2, or 3 years, and then the fees associated with those years are shown. If you are a veteran or receiving Social Security disability or SSI, you do get a 50% discount. And should you have a terminal diagnosis, the state does waive all fees for yourself and one person that the state calls a caregiver, or a person who can purchase on your behalf. Both of those applications, the fees are completely waived, and you are able to have a 1-year card during that time. So on this chart, it does talk a little bit about the opioid alternative pilot program. Everybody who's viewing would obviously qualify for that program as well, but it is a 3-month card, so you have to keep going back to the doctor, which I'm sure most of us do. But you have to go back and get recertified every 3 months. So a lot of people opt in for that first option just because you have the card, and you can have it for up to 3 years without going back and recertifying. This is again from the Americans with Safe Access book, talking about can your doctor certify for you. Sometimes if individuals have a conversation with their doctor and their doctor is not sure, may I certify, can I certify, they absolutely have the right to say they don't want to certify. But if there's a question of can they certify, the answer is yes. By being an MD, a physician's assistant, or an advanced practice registered nurse, they are automatically qualified in the state of Illinois to certify. And then a tad bit of information here about adult use purchasing. Perhaps you don't want a medical card, you just like to try cannabis. Just a little bit of information for you here. Adult use does have a tiered tax bracket. So depending on the THC level of the product that you're purchasing, your tax percentage will reflect that. And the percentages that are here, the 10, 20, and 25% tax, those are base tax without the county tax, sales tax, and any other tax that the municipality may have. So taxes can get up to 40% for one product, depending on where you purchase it at as an adult use or recreational guest. On the right side of this slide, excuse me, this is just breaking down the limits that are allotted to you if you were to not have a medical cannabis card. So you can see that there are limits based on routes of medicating. It's broken down into a flower limit, a concentrate limit, and then an infused limit. Infused is talking about topicals, transdermals, and edibles. And these limits apply to purchase limits, so how much you can buy at one time, and then also possession limits, so what you're legally allowed to have on your person at any time. And again, this is if you don't have a medical card. Lastly are some additional resources. So if you would like more information about delving into some of the vocabulary we talked about, have questions about medical cards, we do have a class coming up on the 14th about that. And then we do have our quarterly Ask a Pharmacist event coming up. If you're interested in talking to a pharmacist about maybe medication interactions, dosing, product recommendations, things like that, we do offer, all of these are digital as well. So our pharmacist event, we do ask people to submit their questions beforehand, and then we organize them all. But if that's something you're interested in, please reach out to me. I'm happy to get you that information. Our pharmacist is on staff in Ohio, Dr. Katie Pack. She's incredible. So if you do have outstanding questions or questions about medications, definitely a great thing to attend. And then you can always see us, see what we're doing on our Facebook page at Rise Dispensaries. And then this map to the right is just a little image of where we exist. So if you're traveling or you have to be out of town and you would like to go to a Rise dispensary, you're welcome to. We are always happy to help and provide any sort of education that we can throughout your journey. And then, yeah, lastly, here is some of our contact information, and that will wrap it up. I'm happy to answer any questions.